Many couples believe that as soon as they start having unprotected sex, they will get pregnant. But in fact, studies show that 1 in every 4 couples take a year or more to conceive. Hi, I'm Dr. Sherazad, and today's video is all about conception. We'll cover the basics of conception, how to prepare your body for pregnancy, the ideal time to have sex, and the best sex positions when you're trying to conceive. Now, the first step before you even start trying to conceive is to make sure you're ready. And I don't mean physically. Getting pregnant means being financially and emotionally ready to raise a child. Sit down and have a conversation. Make sure you both want a baby and have the baby talk as soon as possible to ensure you're both on the same page. It's okay if you or your partner are overwhelmed about planning a pregnancy. This is a big life decision. Whatever you decide, communication is key in healthy relationships. Once you've both decided that you want to have a baby, it's important to prepare your body and understand how pregnancy occurs. A woman's body releases 1 egg every menstrual cycle in a process called ovulation. Your cycle can be divided into 2 phases, the pre-ovulatory phase and the post-ovulatory phase. The first day of your cycle is the day you start bleeding. The pre-ovulatory phase lasts from this day until the day of ovulation. Estrogen is the dominant hormone during this phase. It causes a surge in a hormone called LH, which triggers ovulation. The released egg now travels down the fallopian tube and down the uterus into the cervical canal. The phase after ovulation occurs is called the post-ovulatory phase. Progesterone is dominant in this phase and helps nourish the uterine wall to prepare for a possible pregnancy. Pregnancy can only happen if sperm is present in the body when an egg is released. If the egg gets fertilized by a sperm, then it settles into the thickened uterine wall. If the egg is not fertilized, progesterone levels decrease and the uterus starts shedding its walls, resulting in a period. Before you actively start trying to get pregnant, there are some great ways to prepare your body. The first thing to do is to start taking folic acid supplements. Folic acid is essential for your baby's brain and nervous system development. But the supplements should be taken even before you're pregnant. The CDC recommends that you start taking folic acid supplements 2 to 3 months before you plan to get pregnant. Once you have decided to conceive, you should start taking folic acid supplements immediately. It's advisable to quit smoking and limit or eliminate alcohol intake. In women, alcohol increases the risk of miscarriages. Drinking alcohol affects egg quality and quantity and also impairs proper conception and implantation. And in men, alcohol lowers testosterone levels and impairs sperm production. Couples who smoke are twice as likely to be infertile as those who do not smoke. You should also avoid drugs, including marijuana, while trying to conceive and during pregnancy, as it can cause premature delivery or birth defects. Aim for a healthy body weight. Studies show that 43% of women who have menstrual irregularities and ovulation and increased risks of miscarriage are obese or overweight. In obese men, testosterone levels are lower than normal, which reduces sperm quality and motility. Obese men are also more likely to suffer from erectile dysfunction. For overall health, exercise 30 minutes a day to keep your body weight within a healthy range. A balanced diet can boost fertility in both partners. Include whole grains, leafy greens, fish, fruits, and unsaturated fats in your diet. Eating an unbalanced diet rich in sugar, saturated fat, and animal proteins can cause ovarian dysfunction in women and poor semen quality in men. When you eat a good diet, you'll increase your overall health and therefore your chances of getting pregnant. Sperm can survive in the female body for up to 5 days, and an egg lasts for 24 to 36 hours in the female body. The period where both the egg and sperm are present is your fertile window, 4 days before ovulation and up to 1 day after ovulation. This window is the optimal time to have sex with your partner and conceive successfully. It can be confusing to predict your window. That's where Inito comes in. Unlike other fertility trackers that measure just 1 or 2 hormones and just say yes or no, Inito is a one-of-a-kind fertility monitor that helps you track all 4 key fertility hormones at home in less than 10 minutes. With Inito, you can find accurate values of FSH, estrogen, both alpha LH and beta LH, and progesterone metabolite PDG, which tells you if and when you have ovulated. Inito tells you when to test so you stay updated about your fertile window and maximize your chances of conception by trying to conceive when you hit peak fertility. Check in with your hormone levels anytime and track your cycle trends with detailed charts and numbers. You can share your results with medical experts or nutritionists to track your progress and tick off your health goals. Now, which is the best position to conceive? There are a lot of myths about how to have sex in order to boost conception successfully. However, the fact is that there are no specific sex positions that can increase the chance of pregnancy. And no, you don't need to raise your legs after sex either. Sperms are good swimmers and simply need a clear path to the cervix to do their job. When should you visit a doctor? Generally, if you're below 35, you can consult a doctor if you've been trying for over a year and have not become pregnant. If you're older than 35, you should visit a doctor after trying to conceive for 6 months. If you have a family history of miscarriages or a past history of irregular periods, then consult a gynecologist before you begin trying to have a baby. Thank you for joining me today. I'm Dr. Sherazad, and on behalf of Team Inito, I wish you the best of luck on your conception journey. If you've liked this video, please hit subscribe for future videos about fertility.